Welcome, friends. Today we are speaking with Livia Manta, a senior obstetrics and gynecology doctor for over 18, almost 20 years. It doesn't seem like it, but she's been practicing this profession for a very long time, and I've known her for about the same amount of time. We are speaking now directly from the on-call room. Livia is currently on call.
I woke up this morning so nicely and I said, I woke up in the morning just like that, and I thought I'd do a Zoom call.
It seemed very difficult for Livia because she's always with the babies and the mums. And this time, I wouldn't like to talk about babies and mums, even though I know it's her favorite subject. But I know she has a lot of advice to give us regarding menopause and perimenopause, which many women, they don't really know, and it creeps up unnoticed. And we want to be warned about. We know roughly what symptoms appear, but tell us why we feel more tired. Why are we? Perhaps some are more irritable and we don't realize it. It seems like everyone has something against us. Our bones ache, our joints, but how do these symptoms actually manifest, and why do they appear?
Yes, a very good question. Every woman needs to understand that the first hormone to decrease in perimenopause, even up to 7 years before menopause sets in, is progesterone, which, for a woman, is the natural anxiolytic. It's hypnotic. It calms us and gives us that sense of well-being, of sleep, of peace. Even after 35 years of age, it starts to decrease gradually, but after 40, it is noticeably felt before estrogen. Until perimenopause, which means exactly the transition period between having periods and not having periods. So, the final part before menopause sets in. This can last a few months, a year. Until then, the estrogen level is somewhat normal. But the progesterone level decreases. This can cause irritability, nervousness, insomnia, mood swings, and an accentuated premenstrual syndrome.
So, this perimenopause, when does it? Many women think, oh, this perimenopause is from 35 years old until 50. When?
Perimenopause is a term. Perimenopause is another term. Premenopause is something that starts about a few years before the onset of menopause.
Okay.
So, after the age of 40, women usually they start to become symptomatic, entering into a premenopause. Perimenopause is actually the transition period when cycles become spaced out and very irregular. Sometimes they occur every 2 months, sometimes twice a month. That's when estrogen fluctuates a lot, sometimes high, sometimes low, but anyway, an estrogen is in a continuous decline after the age of 40. So, the decline in ovarian function begins around the age of 40 due to the decrease in follicular reserve. That is, the follicles and oocytes that we have in the ovary and which normally produce estrogen and give us a sense of well-being, slowly come to an end. That is, we had ovulations, and we started to finish them, and they no longer have the strength to secrete as much estrogen. However, the values remain within normal limits, but they are not like in youth. We feel this. And in perimenopause, they start to fluctuate a lot. The ovary effectively no longer has strength. With the last oocytes, there's now an ovulation, then after that, 2 months. There's no ovulation, sometimes it's high, sometimes it's low. And this causes some terrible disturbances because our body, which is accustomed to estrogen, that's how we actually function. We function well with it.
We women.
Yes. We can't be normal without it.
Well, do we go to the doctor to get estrogen? Is something administered? Do we need to see a doctor during this period?
Yes. So, in the premenopause period, a very light and simple supplementation is done. Progesterone. Simple, natural progesterone, administered an hour before bedtime, so a very good sleep, which is a natural sleep. After all, it's our body. It gives us this calmness and provides us with a good sleep. It's not like a sleeping pill. It's not a hypnotic. It's our body that we are missing.
Look, we have a lot of benefits from this natural progesterone. Firstly, we feel better, and secondly, we sleep better. Right. How much do these symptoms bother us, Anne? What can be the most severe? What could it be, I wonder? We are interested in what to avoid.
Well, 70% of women have them, not all. Firstly, yes, 100% of women will develop, regardless of whether they have had premenopausal and perimenopausal disorders or not. The complications of menopause. Even if you haven't had symptoms, you still develop complications. And your health condition worsens significantly. What I want to say is that cardiovascular disease sets in because the estrogen that keeps our skin beautiful and elastic also keeps our blood vessels beautiful, elastic, and clean. What protects us from cardiovascular disease, from heart attacks up to the age of 50, from severe atherosclerosis? When we no longer have estrogen, our blood vessels age, apart from the skin, as it starts to show on the outside during menopause. We develop wrinkles. Yes, that's what happens to our blood vessels too. The skin gets drier, more wrinkled. That's what happens to our blood vessels. They lose elasticity and then high blood pressure appears. Cardiovascular disease appears. And women catch up with men in terms of cardiovascular risk. What can be done? Well, what can be done? What can be done is to continue with estrogen supplementation. Because we cannot live well like this, apart from osteoporosis, mental disorders, and cognitive function decline. So we no longer think.
It's incredible.
Of course, we lose our memory, we lose our ability to concentrate, and we have a sort of fog in our brain, a fog, meaning you're not yourself. Yes, I. So these hormones also act on the brain as neurotransmitters. It's that serious.
Life intervenes because we are here with a specialist doctor, is it? Influenced. Can we still get pregnant? No.
Only with procedures and prior preparation. Meaning, if you properly estrogenize a woman, give hormones, and perform an egg transfer, meaning an embryo transfer, but with donated eggs, not her own, because hers no longer exist. They are finished. Done. It's no longer a break. A load can be maintained, yes.
How is the intimate life affected?
There appears a decline and a disaster. Yes, well, how? Libido disappears. I mean, it disappears. Because libido is something hormonally supported. Certainly. And we see this in menopause, in breastfeeding, when sometimes it decreases, so libido disappears. Well, it resembles menopause a bit. That period. Vaginal dryness appears. Vaginal atrophy, because the vaginal tissue is dependent on estrogen hormones. They keep it trophic, elastic, and thick. That is, the vaginal epithelium is thick. In menopause, it thins out a lot and becomes dry and thin. Because of this, we constantly have a sensation of burning, itching, discomfort. And besides that, to make it even worse, urinary incontinence also appears because the bladder and urethra are hormonally dependent. The bladder trigon behind, the vaginal wall. Anteriorly, it is an estrogen-sensitive area. In menopausal women, atrophy also occurs there, which causes a condition called polyuria, meaning women urinate a little and often and experience symptoms similar to an infection. Urination. And there are patients who come to me with 20 urine cultures done. And they say, I feel as if I have a urinary infection. But in fact, they have an estrogen deficiency, and when you give them estrogen, the entire urinary infection is resolved.
Good, I understand. So, the best advice, or as a summary? A simple summary of all the advice you've given is to go to the doctor, because we might need this estrogen and the formula that suits us. Another piece of advice now, at the end of our discussion today.
Another piece of advice. Do not neglect yourselves. Do not wait until it's too late, because when osteoporosis has set in, cardiovascular disease has set in. It can happen, and then start the replacement therapy. So, replacement therapy can be started even 10 years after the onset of menopause, but by then the quality of our vessels and bones has already deteriorated. That is, you start a therapy to prevent further deterioration, but for it to be ideal, you should start when menopause sets in and those deteriorations do not occur. In other words, you simply keep yourself young. The sudden aging doesn't occur, so don't be afraid, because there is an option for everyone, even for women who have had breast cancer. There are studies now showing that transvaginal estrogen can be given for these issues. Urination and vaginal, which is not absorbed into the body, but it very effectively manages urinary symptoms. Atrophy, urinary incontinence, which are also dreadful. So we can even help them. And not even a history of cardiovascular disease, as there was a fear of thrombosis from the replacement therapy, which is no longer valid, so it's no longer valid. Even they can receive treatment. So, there is a solution for them too, administered transdermally, to avoid the hepatic passage and not increase the amount of coagulation factors in the liver. So it bypasses the liver and avoids increasing the production of coagulation factors. It is administered transdermally and the thrombotic risk is 0. So I don't know why we bothered to struggle.
That's what I mean, I don't know why. A lack of information on our part as women, because when we feel this period approaching, we should consult a doctor to get through it more easily. And first and foremost, to maintain our health. Livia, Manta. Thank you very much. If you wanted to add anything else.
I have patients who have started and who say, I can't live without replacement therapy anymore. As soon as I stop it, I can't sleep again. Awake with eyes on the walls all night. I can't. I tried for 2 months and no one could understand me anymore. I wasn't sleeping at all. Something terrible. So I have very good feedback. Personally, when I reach that point, I will definitely do it.
Good. Thank you very much for all this advice. My dear ones, this was our discussion for today. A useful discussion for both the ladies and the gentlemen who are beside them and want to support them.